Good afternoon, everyone, and welcome to the FY23 Rural Health and Safety Education RFA Technical Assistance webinar. We are going to pause for about 30 more seconds and give others a chance to join. So if you'd be patient with us, let's pause for about 30 seconds. I am going to transition the slide so you can just see some of the meeting logistics to keep in mind. Well, greetings all, and again, welcome to the Rural Health and Safety Education, RFA Technical Assistance webinar. Glad you were able to join us this afternoon. On the slide here on the screen, you will see some of our meeting logistics. This webinar is being recorded, so we ask that you would keep your microphones muted. If you're having any issues with Zoom, here is the tech support number. And just want to let you know, throughout the presentation, if you have questions, there should be a Q&A box. Feel free to click on that Q&A box and enter your questions there. After the presentation, there will be an opportunity for us to respond to the questions that you enter into that Q&A box. Also note that the slides, the PowerPoint slides, and the recording will be added to our funding and program page within a week. Before we get started, I want to cover briefly the USDA Non-Discrimination Statement. I will not read the entire non-discrimination statement, but I will read the first bullet and briefly summarize the second 2 or 3 bullets. In accordance with federal civil rights laws and the U.S. Department of Agriculture civil rights regulations and policies, the USDA, its agencies, offices, and employees, and institutions participating in or administering USDA programs are prohibited from discriminating based on race, color, national origin, religion, sex, gender identity, including gender expression, sexual orientation, disability, age, marital status, family, parental status, income derived from public assistance programs, political beliefs, or reprisal or retaliation for prior civil rights activities in any program or activity conducted or funded by USDA. Note that not all bases apply to all programs. Remedies and complaint filing deadlines vary by program or incident. The second bullet is providing contact information for those who might have disabilities and need accommodations, or those with limited English proficiency who also need support. The third bullet, if there is a desire to file a program complaint for any reason, contact information is provided here as well. And again, USDA is an equal opportunity provider, employer, and lender. Now, to our presentation for today. Brief introduction, my name is Edwin Lewis. I am the National Program Leader for the Rural Health and Safety Education Program. Glad to be joined today by our program specialist, Isabella Jablonska. So I will be presenting. Isabella will be helping us with our chat and our Q&A. So as we get to the end, she will facilitate our Q&A session. Here's just a brief agenda for today. We'll start off with a brief NIFA overview. Then we will provide a brief overview of the Rural Health and Safety Education Program. We'll go a little bit into the details of the RFA. We'll talk about proposal evaluation process. And then at the end, we'll share some information and resources that you might find useful. And then again, finally, we'll wrap up with some Q&A. So NIFA overview. NIFA, the National Institute of Food and Agriculture, is the extramural science funding agency within USDA's Research, Education, and Economics mission area. NIFA invests in and support initiatives that ensure long-term viability of agriculture. NIFA also provides funding and strategic leadership for programs that ensure groundbreaking discoveries in agriculture-related sciences and technologies to reach the people who can put them into practice. NIFA covers a number of different topics. You can go on our website and take a deeper dive into all of these topics, but they range from animal to natural resources, environmental, human sciences, food science, plant, and many more. Again, feel free to explore our website for additional program information, funding opportunities, and program contacts. Now to the Rural Health and Safety Education Program. This program seeks to support quality of life in rural communities by addressing the relationship between rural prosperity and rural health and safety in the context of food, agriculture, natural resources, and human sciences. For the past several years, the program has focused on individual and family health education. That includes information that centers on putting health information in the hands of rural residents, empowering them with education to realize their own optimal health, as well as training those serving the health needs of rural communities, especially through partnerships. So again, as you look at these areas, these are the areas that we will be supporting in terms of funding. So projects related to these 5 areas, they are also on page number 7 of your RFA. Now, priority focus. In addition to the areas that we highlighted on the previous slide, in accordance with the 2018 Farm Bill, there is also a focus on proposals that will support prevention and reduction of opioid misuse and abuse. Again, this is in addition to the areas on the previous slide. You'll also find this on page 7 of the RFA. A priority approach, again, not the only approach, but one of the approaches that we are highlighting and prioritizing is the utilization of telehealth, telemedicine, and distance learning strategies for opioid and substance education and training in rural communities. So who's eligible to apply for the Rural Health and Safety Education Program? Eligibility is limited to the land grant universities. Our 1862 land grants, our 1890, and the 1994 tribal colleges. Now, these universities can subaward and partner with other entities that they deem essential for carrying out their projects. Award limitations. So NIFA anticipates making multiple awards in FY23. In FY22, we awarded 14 projects. The year before that, 12 projects. Funding for this year is level from last year at $5 million. And so again, we plan on awarding anywhere from probably 12 to 15 different projects. Not an exact number right now, but multiple. The maximum award will be $350,000. One of the new changes in the RFA this year is we've expanded the period of performance from 2 years to 3 years. So in previous years, you would submit a budget for 2 years. This year, FY23, you'll be submitting, regardless of what the amount is you're requesting, a budget for 3 years. And again, that amount is capped at $350,000. Project type, and then you'll find this relevant as you begin to apply for this opportunity. Our project types are extension projects, and the grant type are standard grants. More information about this on page 10 of the RFA. So what are some of the project requirements? Project requirements. First, implement research-informed, outcome-based programs and approaches. Second, utilizing cooperative extension as a mode of program outreach and delivery. It does not have to be the only mode, but it must be an essential mode of your project, the use of cooperative extension. Also required by legislation, this program must focus on rural areas. And so listed here, there are links to these federal classifications of rural areas on page 11 of the RFA. So again, you want to use the resources in the RFA and those links to make sure that the areas you're targeting meets the criteria of the program. Additionally, you want to solicit community buy-in regarding the issues that are being addressed through your project and the approaches that you are taking. So community buy-in is important. Also, plan for coordination of your program. It is also a legislative requirement that you engage with state offices of rural health or other appropriate programs of the Department of Health and Human Services. For example, SAMHSA's Center for Substance Abuse Treatment. So again, state departments, state offices of rural health, or other relevant programs within the Department of Health and Human Services. Report on performance. I also note here that NIFA strongly encourages involving an evaluator on the proposed project to help develop outcome-based measures and plan for evaluating project performance. So again, including that evaluator upfront in your planning will be critical. Utilizing a theoretical and/or practice framework is also essential. And then finally, dissemination of information, a plan for how you will disseminate and share information as a result of your program is critically important and should be clearly described in your proposal. So these are recommendations. Recommendations to keep in mind: collaborate across extension program areas where appropriate, depending on, again, the focus and objectives of your project. Include content experts from across academic and clinical domains. There are a number of universities that, in addition to their College of Ag, in addition to their Family Consumer Science area, there may be a School of Medicine, a College of Medicine, or a College of Public Health. There may be opportunities to collaborate across those parts of the university. So keep that in mind. Design projects to include policy, systems, and environmental change strategies. Implement adaptations to existing evidence-based programs. And then finally, promote principles of health equity and creating a culture of health. So again, factoring in topics such as social determinants of health and how that plays into your project is recommended. So some additional recommendations: promote community empowerment as a tool for sustainability. Again, we talked about engaging the community and getting buy-in. We see that as critical for sustainability. Increase professionals' capacity to engage in health leadership and in the rural communities. Increase public access to new ideas and technologies. Increase public knowledge and engage in health systems. And those health systems, again, local, regional, state, federal. And if relevant, increase utilization of telehealth, telemedicine, and distance learning strategies for education and training. So some good practices just to keep in mind. Again, define who your audience is. Who is your audience and where are they? And what is it that they need? Also, how will you engage them? Clearly describe how you're going to engage that community. What is your plan for education and assisting them? And then another good practice is propose a solid plan of work. Make it compelling, whatever that need is, make it compelling. And strike the balance between an ambitious proposal, yet an achievable proposal, considering the time constraint, considering the funding constraint. Again, ambitious, yet achievable. Also, make sure that you're using current data to support your project. Avoid duplication of efforts, and we'll talk a little bit more about that shortly. And then partnerships. Plan for promising and powerful partnerships that make sense and enhance your project. So finally, in terms of good practice, is just do your homework. And this gets back to the duplication point. You can expand, innovate, improve, and avoid duplication by reviewing past and current rural health and safety education projects. The link you see here is from our CRIS database, the NIFA CRIS database. This particular link can also be found on the Rural Health and Safety Education program and funding page. So if you go to the NIFA website and you search for Rural Health and Safety Education and either go to our program page or our funding page, this link will pop up. And once you click on it, this is the image you will see. What you see now is really the top of that list. But when you click on that link, as you scroll down, it'll go all the way back to, I believe, 2007 in terms of projects that have been funded. In this last column to your right, you'll see that you can see a brief synopsis of the project, or you can get a more fuller description of the projects that we have funded. So real quick, just want to cover some application do nots, things that we do not fund. Applications without a plan for measuring participant outcome. So again, including that evaluator up front and making sure you clearly describe how you're going to measure outcome is essential. Applications planned for less than 36 months. So again, we have expanded the time frame based on stakeholder feedback. And so now we're looking at a 3-year period of performance. So if you submit a project and you're shorter than that, a 2-year period of performance, we cannot review that particular proposal. So again, a 36-month period of performance. Applications with a focus on topics that are specific to other program areas such as AFRI, Agribility, the Farm and Stress Assistance Network, Youth Farm Safety, et cetera. So if you were attempting to apply to another program and you didn't get funded, you want to be careful about just resubmitting that program to Rural Health and Safety Education without making sure that it actually fits the goals and objectives of the program. So if your program appears to be specific to another program and not really fitting the goals and objectives and purpose of Rural Health and Safety Education, it will not be considered. Applications with a focus on research. Again, our mode is extension and outreach. If there is a research focus, it should be really focused on the evaluation of the project. Not the delivery mode of the project. So we're not funding research through Rural Health and Safety Education. We are not funding formal education, and we're not funding clinical interventions in this program. And then lastly, applications focused on clinical treatment of individuals with substance use disorder. Again, not focusing on any clinical interventions or clinical treatments. The other thing that I will share that we are not funding, I know I've gone to the other slide, but I received this question. In terms of multiple submissions, we are not accepting multiple submissions from the same PD or PI, but multiple submissions from a university is acceptable. So multiple submissions from a university acceptable, multiple submissions from one PD or one PI as the lead is not. Regarding cost share and match, this program does not require match. And if you decide to match, that match will not be factored into the review and evaluation of the project. It will not count against, but you will not get extra points for including a match in your project. So let's talk a little bit about the application details. First, again, just reiterating that the major change from previous years is the period of performance. We have switched from a 24-month, 2-year period of performance to 36-month period of performance. Keep this in mind if you are resubmitting a proposal that was declined in previous years, because if you did, again, your proposal, your budget was for 2 years. This year, we are requiring a 36-month budget to go along with the period of performance. So keep that change in mind. Additional application details. So the RFA is online. You can find it on the NIFA website. This link goes to the funding page for rural health and safety education. So again, if you go to the NIFA website and you search for rural health and safety education, the funding page and the program page will come up. So there's the link here, but you can also just go to our website and search for it. It's also located on grants.gov. The deadline for applications, 5 p.m. Eastern time, 5 p.m. Eastern time on April 28th. 2023, you must submit through grants.gov. Applications can only be submitted through grants.gov. And again, I want to emphasize 5 p.m. So make a plan to submit your application early. A second late is too late. It will not be considered. Again, total funding that's available in FY23 is $5 million. Keep the program code in mind, LX. That is also located in the RFA on pages 1 and 10. So that program code is going to be essential as you apply to this opportunity. And again, the maximum funding per year, the maximum funding that you can apply for in FY23 is $350,000. And just keep in mind that submitting a request for $400,000, anything over what is the max, is what we would consider a fatal flaw. It will not be considered in terms of going to panel for review. Key documents to keep in mind in your application. Really, I'm going to direct you to the RFA, pages 16 through 21. These are this is where you want to focus your attention on making sure that you're not missing anything. But those key documents will include your project summary or abstract, your project narrative, your bibliography and reference list. A data management plan is required. And again, other documents that you will find in the RFA. Again, I direct your attention to pages 16 through 21 of the RFA. Review it closely to ensure that if you go through the time to prepare a application package, you include all of the required documents. Again, application details, just a few other details to cover here. In the project narrative, which is really the meat of your proposal, is going to be limited to 24 pages. Do not go over 24 pages, strictly enforced. Again, a fatal flaw if you include more pages. Double spaced, 24 pages, double spaced, 12-point font. And again, that same 12-point font can be used in your tables and in your figures. But in your tables, you can single space. So tables can be single spaced. But again, the rest of your text should be double spaced. There's some details here about what should be included in the 24 pages of your project narrative. but primarily I want to focus you back to page 16 and the description in the RFA on what is included in your project narrative. So make sure that you go through that closely of the content that's required in your project narrative. But again, please do not go over the page limit of 24 pages, double spaced, 12-point font. Data management plan is also a requirement, and investigators must provide details, business and management plan that will include expected data type, data format, data storage and preservation, data sharing, protection and public access, and roles and responsibilities. If you go to the NIFA website and you do a search for data management plan, there are the resources that you'll find on this link. You'll find when you do that search. There's a lot of good information about how to prepare and what goes into your data management plan. Also, you can probably find this link, I believe, in the RFA on page 21. So again, see what's in the RFA, page 21. Also spend some time on the NIFA website reviewing the guidance provided under this link for data management plan. Application submission. So all the applications are going to be submitted electronically, again, through grants.gov. That is the only way we are accepting applications. In the RFA on page 16, there is a link to the grants application guide. So it's a great resource. So if, again, on page 16 of the RFA, you will see this link. Spend some time in there. Great guidance on the application process. And another fatal flaw is not submitting your application as a PDF. You must submit it as a PDF. So let's talk briefly about the evaluation process. So proposals are assigned to our peer reviewers. There will be at least 3 panelists who will review your applications. These panelists will have some expertise in the area related to your topic. And so those reviewers are responsible for reviewing the applications separately and providing some comments on the strengths and weaknesses of that proposal. And they'll submit that written feedback. And then we will convene the panel, and the 3 or 4 reviewers who have reviewed your proposal will review and discuss them in the panel context and come to a consensus on the final rating and ranking of your proposal. So that is our evaluation process. If you are resubmitting, the one thing you want to make sure that you do is include, and it's the guidance is in RFA, include a response to the previous year's panel's comments. And so in panel, we will also discuss, or they will discuss, how you responded to the comments from the previous panel as well. The evaluation criteria. So this is, again, important to keep in mind. We hold our panelists responsible for not going outside the parameters of the evaluation criteria that is delineated in the RFA. So as you are preparing your proposal, it is critical that you keep in mind the evaluation criteria that panelists are measuring your proposal against. So the issue statement and planned approach, the objectives and activities, the outcomes and timelines, the division of labor and expertise that you're bringing together through your proposal, your project performance assessment plan, again, the importance of your evaluator, your management plan, your budget and your budget narrative, your project communication and information dissemination plan, and how are you going to make this project sustainable beyond the life or the funding for the project. So how do you become a peer reviewer? One of the things that you want to keep in mind, and this goes across, not just for rural health and safety education, but all of our programs, if you want to really learn more about a particular program, if you really want to learn about the process that takes place for evaluating proposals, no greater opportunity to learn than to becoming a panelist for NIFA on one of our panels. You can do that by reaching out to a program person, a national program leader, a program specialist like Isabella, expressing your interest. I encourage you, this third bullet, to go on our website and enter your information into our panelist database. We regularly use that database. We can search by expertise in there. And so if you put your information in there, your areas of expertise and availability, it is a great resource for us, and it creates a greater opportunity for you to be selected for a panel. So what's our timeline? You submit the application, and then so what does the timeline look like after that? So first, the proposal, the Rural Health and Safety Education, RFA, has been released. It is scheduled to be out for about 60 days. So about 60 days before the deadline. Once the deadline ends, there is about a 2 to 3 month period where internally, Isabella and I and our panel manager will do an initial review. We will select our panelists, we will convene them, and we will get program or funding recommendations from our panel. That process is about a 2 to 3 month process. After that, the process for recommending awards up the chain in that process, and then getting money out the door awarded to the institutions, that could be up to another 2 months. So again, just keep in mind, after the deadline, once you submit and the deadline is passed, it could be anywhere from 3 to 5 months before you hear a final decision or you receive funding for an award for FY23. So just want to keep that in mind. But at any point, feel free to reach out to myself, Isabella, if you have questions about what's happening in the process. So let me just share some quick tips for success. I know we have a range of experience with submitting proposals, but just want to make sure that we are providing as much information as possible to ensure or to support the success of potential applicants. So just want to share some brief tips for success. The first tip is excite the reviewer. So remember, our reviewers will review multiple applications. They'll review anywhere from 8 to maybe 12 proposals. So make sure that your proposal stands out, that it's exciting. The issue that you are addressing is really relevant, and the approach that you're taking is innovative. So excite the reviewers. Make sure that it's well written, it's succinct, and it's logical. You don't want the reviewers to work hard just to try to understand and grasp your proposal. So make sure that it's well written and it's succinct and it makes sense the way it flows. Make sure that you're addressing an important challenge or problem in a rural, related to rural health. Take an innovative approach and don't duplicate what other folks are doing. Be innovative in your approach. Have a solid and detailed plan for identifying the needs for program development and program implementation, and have a solid and detailed evaluation plan for outcome-based reporting and measuring impacts. So again, we talked about fatal flaws earlier. These are, again, just your big don'ts. In the RFA, we lay out required information, required documents, required information. Do not miss any of those parts. Again, there's an initial screening before your proposal goes to panel. If you are missing required documents, it will not go to panel. If it is not in PDF format, we will not move it forward. If you're over the page limit, it is a fatal flaw. We will not move it forward. If the budget exceeds the limit that's allowable, we will not be able to move it forward. And if your proposal is late, if it's a second late and it does not come through, again, it's a fatal error, and we cannot move that proposal through. So keep those major don'ts in mind. And just a few major do's, if you will. Have someone to read your proposal and identify any lack of clarity, any unanswered questions and other flaws, and then take your time to address them before you submit your application. So having someone who has very technical expertise in what you are proposing, as well as maybe someone who's more of a layperson who says, I don't have the depth of knowledge in that area, but I really follow the logic of what the issue is and what you're proposing to accomplish in your project. So having someone, maybe one or two people to review is a major do. Some other common criticisms that we hear from panelists. And if you haven't served on a panel, this is really good for you to know. If you have served on a panel, you've probably made these comments about other proposals. The proposal's vague, it's unfocused, or it's poorly presented. The audience impact is unclear. It's not well justified. Insufficient review of other projects. The work plan is not clear. It's not logical. There's not enough detail. We talked about the balance between having an ambitious proposal and an achievable proposal. So make sure that it is ambitious, but also achievable. So one of those complaints is this is way too ambitious for the budget and the time frame that they're talking about. Project director or the team lacks relevant experience or expertise. Weak collaboration or poor management plan. Lack of letters of support from consultants or partners. Again, they've mentioned several folks who are interested, who they plan to partner with, several external entities, but there's no documentation of their commitment to be a part of that project. And unclear what difference the rural health and safety education funding will make. Either they've already done this work, it seems like a duplication of effort, or it's just unclear again about the impact that this project may have. Just a few additional resources that we want to share before we wrap up. On our website, there is an events calendar. So feel free to go to our website, check out upcoming webinars and deadlines and meetings that we have for our stakeholders that you may find interesting. And again, there are a number of funding opportunities across NIFA. And so there is a calendar on our website where you can see RFAs that will be released in the future. So feel free to check out those resources on our website. And then finally, on our website, there's just a number of resources that can assist with your overall grantsmanship, especially as it relates to NIFA opportunities. So I'll encourage you to find our grants resource page. There's just a lot of great information out there. Again, some of it very specific to NIFA programs, others just, again, good grantsmanship guidance and tips and resources. So I want to leave that with you as well. And again, I think that is our last slide. We'll pause at this point for question and answers, but in addition to putting questions in the chat, here's my email address. Here's Isabella's email address. If you think of questions afterwards, as you're working through your proposal, feel free to reach out to either one of us with your questions, and we'll be glad to respond to your questions then. But at this point, we're going to pause, and I am going to turn to Isabella to see if we have any questions in the chat.
Yes, we do. So we do have, I'm sorry about that. We have a question about the definition and maybe some clarification about what clinical interventions means. Someone asked in the chat here that they would like to teach farmers Stop the Bleed, which is a course using evidence-based approaches to teach people how to stop bleeding. And just wondering if that's something that would qualify for this program. I did mention that there's more information about what NIFA will not fund on page 9 of the RFA, but I still do think that maybe some further clarification might be needed there. Oh, you're muted, Edwin.
Hey, thanks, Isabel. In terms of clinical intervention, again, we are not treating any disorders or supporting the treatment of any disorders, but we are supporting education and information about these disorders. We are supporting training of those who are working in those rural communities. And so when we talk about those clinical interventions, we're really talking about the funding of interventions that would be carried out by, for example, one-on-one psychology, intervention by a psychologist, or intervention by a medical professional that would be considered treatment, if you will. But education on disorders, I believe that was one of the things mentioned, and sharing that information. Those are the types of things that we are supporting. If I am not answering that question sufficiently, feel free to reach out to me directly afterwards, and we can engage and make sure that we provide the clarification that you need.
For right now, I'm not seeing any additional questions, but if there are any more. Oh, there one actually just came in. So this person has typed in that their program will be focusing on health behavior and reducing health risky behaviors such as opioid misuse. The RFA seems to be focusing only on substance abuse. So I guess some further clarification might be needed there.
I do want to, I think we mentioned opioid and substance abuse. So yes, if it's focused specifically on opioids, that is allowed. I know in previous RFAs, there was a lot more language in the RFA targeting specifically opioid intervention in education. We've expanded that, saying opioid and substance abuse misuse intervention, but also keep in mind that we're not limiting ourselves to just opioid and substance abuse. Health education in general, if there is a concern in a rural community that falls into opioid and substance misuse and abuse, or the other areas that are highlighted, I believe it's on page 7, if I'm not mistaken, but on right before the discussion on opioid abuse and misuse and substance abuse misuse, we are supporting and will review and consider applications across those areas.
All right. Yeah, for now, I'm not seeing any more questions.
Okay. Listen, I do want to just encourage you all to, if there's any, as you continue to work your way through the RFA, you may review this webinar again. If you have additional questions, need additional clarification, if I responded to your question, but you're still unclear, again, feel free to reach out directly. We will work our way through it and make sure that you get the clarity that you need. Isabel, if there are no other questions at this time.
Nope, none right now.
Okay, well, we will conclude the webinar. Again, thank you so much for joining. Again, if you have any questions, feel free to reach out to Isabella or myself, and we'll be glad to support you as you move forward in preparing your proposals. Thank you so much.
Thanks again, everybody. Bye-bye.